Colon cancer is the second leading cause of cancer deaths in this country, curable if detected early, but late-stage cancer is often deadly. Recent numbers show up to 1/3 of Americans fail to get recommended screenings. Now, though, the American Cancer Society has approved a new and simple screening device. Our medical expert, Dr. David Winter with Baylor Scott and White, here this midday to explain this new screening technique. Dr. Winter, thanks for joining us.
Good to be with you, Erica.
So tell us a little bit about this Shield test.
Yeah, it takes a simple standard blood tube test. You fill this up, send it off to the lab, and that's all there is to it, really. There's no preparation required. You don't have to be on any special diet. You don't have to be fasting. What the company is looking for is little fragments of cancer that are shed into the bloodstream. And it takes about 2 weeks to get that test back. It's been pretty reliable, it seems. The FDA has approved this, and it should be available in most doctors' offices in the near future, Erica.
All right, Dr. Winter, that actually sounds easier than all the prep for a colonoscopy. How accurate, though, is the blood test?
Yeah, it's said to be 83% sensitive and 89.6 specific. Now, that's for all overall cancer testing. But now, for the early stage colon cancer, it may not be quite as good. Maybe 55 to 65% sensitive there. So it's early, not as good, better when it's late stage cancer.
Now, aside from a colonoscopy, what other testing techniques are available for colon cancer detection?
Yeah, for some time now, these stool tests have been around. The FIT test, FIT test, the Cologuard test, both these are well done. FIT test, you're supposed to do that every year. Cologuard every 3 years. And both of these are said to be a little bit more sensitive than the blood test. So you got those options also, Erica.
Okay, a lot of good options. Would you say colonoscopy is still the best way to diagnose early colon cancers?
Well, it's been the standard for a long time, but here's the issue. The preparation is a little rigorous. Some would say uncomfortable. Typically, you're put to sleep with anesthesia. You have to go to a hospital or some urgent care center to get this done. And here's the issue. With all of that, up to 1/3 of people that should be screened are not being screened, as you mentioned at the outset. So that's the problem. So of the 3 ways to get screened right now, colonoscopy, stool test, or this new blood test, which one's the best? The best one is the one that gets done, Erica. More testing needs to be done.
That is you're absolutely right. People need to just make sure they're paying attention to any symptoms or signs, and we really appreciate you joining us this midday. Dr. Winter, we appreciate you.
Great. Good to be with you, Erica. Thank you.